We are back with the Summit County Health Department right now. Dr. Phil Bondurant is the Deputy Director at Summit County Health Department. He's joining us this morning. Dr. Bondurant, thanks for speaking with us.
Hey, good morning. Thanks for having me.
We are incredibly grateful for the Summit County Health Department, your staff, everyone who's working round the clock to keep our county as safe as possible during these unprecedented times. You know, it's been just over a week that the Summit County Health Department has this new order, and I want to check in and find out how things are going with this new order.
So the new order was approved by General Burton, who is the interim director of the Utah Department of Health, and approved by the governor as well as an exemption to what was at the time the Utah Leads Together 4.0 plan. So where we're at with it right now is we are in the process of evaluating the order that was released on April 30th. With some updated guidelines, we have received a few appeals from individual industries and sectors that we are evaluating independently, so that when the order is revised and updated as of May 14th, it includes some of these new industry policies and sectors. One of the interesting aspects that was not typically available when we first put this new order together was many of the state departments have come out with their own industry standards or directives on how to conduct business. And that was not available to us at the time that the order number 5 was written. And now they are available. And the industry has been very good about sending those things to us, allowing us to review those and then potentially include those in the order. So where we're at right now is we actually have a time set aside today to go through the order, review it for relevance, the parts that need to be addressed or updated, and include some of that state language to help bring clarity to the existing order that we have in Summit County right now.
Have you found that these state guidelines are in accordance with county guidelines? Does everyone seem to be on the same page? Are they sometimes contradicting one another? Or does it seem like it's pretty much a smooth transition in that people are agreeing on what restrictions should be in place depending on where you live within the state?
It's different across the state. Obviously, there are areas that have not seen the impacts of the COVID-19 pandemic to the same degree that we've seen it in Summit County. The local Summit County order does align with the governor's Utah Leads Together plan while providing additional clarification. As part of that clarification, there are some additional standards and directives in there that were created by our industry here locally. We have found that our community has pointed out some of those points in there that may contradict one another or that create a little bit of confusion or a sense of confusion. So we're looking to pick those out over the coming few days, add clarity to them, remove a few things that don't make sense that have been brought to our attention, but still align with what the governor is doing with the Utah Leads Together plan.
Do you feel that businesses and community members here in Summit County are following this new order? What are you seeing?
We have received a few complaints, but by far the complaints that we receive do not outweigh the good efforts of our business community. I have been extremely impressed. We had environmental health out last week. Their reports came back good of the businesses that they dealt with. Our businesses have, if anybody was to have an invested stake in this process, it's them. They have to instill a sense of community, a sense of confidence in the community in order for patrons to visit their facilities. So when we look at this, when we look at what our businesses are doing, I've been extremely impressed, but it shouldn't come as a surprise. When Summit County in early to mid-March was in the situation that we were in, it was the community, it was the businesses, it was the general public that took it upon themselves to follow the orders that were given. And that's the reason we find ourselves in a very favorable condition today. It's not what the health department has done, it's the efforts of our community, businesses included, doing what they can to follow the orders, social distance, and do these things that we know limit the spread of COVID in our area.
Now, as businesses are slowly and safely opening and local residences are venturing out a little bit more, how are the numbers? Are you finding them increasing, staying the same, or are they declining?
Are you speaking in reference to the number of people here in Summit County?
Yes, the number of people in Summit County who have been recently diagnosed with COVID-19.
Yeah, we're finding that our trends they continue to support what we've done with our order, that opening up was justified, and we continue to hover a few new cases here and there every day. It's nothing that we would be concerned of. It's what we would expect on the back end of the curve. Everybody had heard the term flatten the curve. We have reached a point where our recoveries on the 21-day model that we're using are trending upward at a very high rate, which is what we want to see. And then, of course, we see a few people here and there pop up with cases. But at this point, most of our community, I believe, is aware of what's going on. When we look at where we are at today versus where we were at a month ago, again, our community has done a fantastic job in helping us find a way to stop this in Summit County. But our cases are exactly where we would expect them to be, and bouncing along that on average about 2.5 to 3 cases per day.
Now here in Summit County, we had some hot spots. Are those still of concern, or are the cases a little more spread out throughout the county? Are you seeing cases in certain areas? Where is that breakdown?
Yeah, so the cases are widespread. We have cases in every municipality, every jurisdiction throughout Summit County. So there's not any one area that is immune to COVID at this point. When we considered it hotspot testing, those were areas where when the addresses of the positive cases were reported, there was a high density there. And what we're seeing now is that many of those cases from that initial testing are on the 14 to 21 day recovery timeframe and are considered recovered. We are not seeing a situation now where there's any one area that maybe is higher than another, but we're seeing more of a consistent spread across our community in terms of everyone is recovering, which is what we want to see, but we're not seeing nearly the number of hotspots, and that's the result of education. People have been educated, brought up to speed on what they can do if they find themselves in an area where it might be multifamily housing. They share a common entryway, a common handrail, something like that. Just a little bit of education and bringing them up to speed and helping them understand how they can limit the spread of COVID and what they can do on their part to play their role helped out tremendously. So yeah, we've seen a good response in regards to some of these areas that people have referred to as hotspots being able to do their part to get this under control.
And what about antibody testing? It's now available here within our area. Do you recommend that to everyone? Who should get tested?
So right now, antibody testing is really the hot topic. We've transitioned from the disease itself to people wanting to be tested for antibodies. And really the concern with antibody testing is that really there's two. The first is that there are tests out there that are not validated, meaning that they have not been, they may have received EPA approval for a fast track, but they have not been approved in terms of, validated in terms of how consistently accurate their results are. So that leads into the next point of concern, and that is people need to understand if they receive an antibody test, they feel that it's necessary, or their primary care physician feels that it's necessary, that this does not mean that they're immune to the COVID-19, at least as far as we know right now. There's still a number of studies underway determining whether or not someone can be reinfected, determining what the reinfection rate might be. And so that exposure doesn't mean that you're necessarily immune to COVID, but it does mean that you've been exposed and that you potentially were asymptomatic. So individuals that feel as though that will help them feel at ease or bring a sense of confidence or a sense of peace, then that's something that you would want to discuss with your primary care physician. But we don't suggest modifying your behaviors based on those results. We want to make sure that people are still social distancing, washing their hands, using sanitizer, wearing masks, because again, the data necessarily don't suggest that there is 100% immunity, and there is a number of studies trying to determine that right now.
We are constantly barraged with new information about this virus, so we really appreciate Summit County Health Department and you, Dr. Bondurant, for breaking things down for us and helping us understand what we should and shouldn't do. Really quickly, before I let you go, you mentioned that there'll be a new order on May 14th or a revision. What are you expecting from that? Are you expecting things to open a little more? Would there be a reason to go back?
At this point, there is not a reason to go back. The data don't suggest that we have regressed or taken a step backwards. What I do suspect will happen with the new order is there will be a significant clarification. Some of those points of the order that maybe cross over one another or create a sense of misunderstanding will be cleaned up a little bit. We will have some of these industry standards that have been provided at the state level included in this order. And again, it's not to create additional restrictions in terms of making it more difficult. This was intended to provide clarification, and I suspect that in this next order, that clarification that's been requested by the community will be included.
Well, Dr. Phil Bondurant, we very much appreciate you taking the time out of your busy day to spend with us, break this information down for us. Very useful. So again, thank you for joining us. Also, thanks to the entire staff at the Summit County Health Department for keeping our county safe. You can head to summitcountyhealth.org online for more information. We'll be back with more right after this.